Continuing education for nursing assistants. This topic includes admissions, transfers, discharge planning, and discharges. Admissions. An admission is an official entry of a person into a healthcare setting. It's a time of orientation for the new patient, resident, or client, and for the healthcare team. It can be stressful for both person and family as they adjust to the emotional aspects of the change. The physician initiates the admission process. Concerns for long-term care. Most do not choose to be admitted. They're admitted sometimes after a crisis. It may require a quick decision when choosing a facility. The family may realize they're no longer able to provide care and have to seek out assistance. It's physically, emotionally, and financially draining. There are feelings of guilt and frustration of failing to be able to care for the family member themselves. The admission process. It includes the orders written by the doctor after the diagnosis of the person. The admissions coordinator or admissions nurse helps the person to complete an admissions sheet. The person is escorted to his or her room. The nurse completes a history. The nursing assistant is responsible for taking vital signs and helping the person become oriented to the room. Welcoming the new person. Making a new person or resident feel welcome. The nursing assistant prepares the person's room for his or her arrival by lowering the bed, putting the head of the bed up, and folding back the sheets. The nursing assistant greets the person warmly and introduces herself. They help the person to settle into his or her new home and practice good communication skills. If the patient's family is present during the admission process, the nursing assistant can ask the family to stay as they may have valuable information to contribute to the team. Question 1. The admitting process into the healthcare facility is a routine process for the patient or resident. True or false? The answer is false. The admitting process is a routine process for the healthcare staff. However, for the patient or resident, it's usually very upsetting and may be emotionally difficult, and they may experience stress and anxiety. The nursing assistant's responsibility is to take vital signs, height, and weight. If a private room becomes available, it would be given to the first person on the list. Identification bracelets. They're placed on the patient to prevent one patient from being mistaken for another. To help maintain a person's identity, a nursing assistant should not refer to the person as a diagnosis or the person's room number. For instance, the gallbladder in room 101B or just 101B. After the patient is admitted, they will have an admission sheet completed, a healthcare order for the patient, and the nurse will have completed the patient history. An admission would not be necessary. For example, a young mother that suffers from asthma, she likely would not be formally admitted to a facility. A transfer occurs whenever a patient or resident is moved within or between healthcare settings. A transfer can be from one room to another, from one unit to another, from one healthcare facility to another. A transfer can be necessary due to changes in the person's medical condition, either better or worse. The transfer must be safe. The patient, resident person, and belongings must be treated with respect and concern. The nursing assistant is responsible to help put the patient at ease, unpack, and help the patient settle in. The patient's personal items should be described on the inventory sheet. The nurse is responsible for reporting information to the accepting RN. If going to a long-term care facility, you may report personal care information to the receiving nursing assistant. Discharges. Discharge is the official release of a person from a healthcare facility to his or her home. The goal of discharge planning is help the patient to achieve the best health status possible after he leaves the healthcare facility. When a person leaves a healthcare setting without a doctor's order against the doctor's advice is called AMA, against medical advice. If a person tells a nursing assistant he or she is going to leave AMA against medical advice, the nursing assistant needs to report this information to the nurse immediately. Question 2. A competent patient is free to leave the medical facility at any time without permission, which is AMA, against medical advice from the admitting doctor. True or false? True. A competent individual is free to leave a medical facility at any time without the physician's permission. However, he or she must first sign an AMA document indicating that they understand the risks of what they are doing. The end.